How can you be more productive in your practice and increase your cash flow while seeing fewer patients? Smart scheduling allows you to prioritize the patients who need you most and maximize your productivity. In this video, you'll learn a scheduling framework that enables you to increase your revenue so you can not only pay your bills, but start building a cash reserve for the future. And if you stick with me to the end, I'll tell you how you can get my case acceptance framework, which will help you close more high-value cases absolutely free. I'm Dr. Anissa Holmes, here with a new episode of Dental Boss TV, showing smart and growth-minded dental bosses just like you how to start and run a truly successful dental practice that gets you excited about coming into the practice every single day. Subscribe to my channel and hit the bell to be notified when I post a new video on Dental Boss TV right here each and every Tuesday. Because you want to serve your patients and grow your practice at the same time, it's vital that you think about efficiency and profitability when you schedule your patients. By the time you finish this video, you'll have a scheduling framework that allows you to prioritize the patients who need you most and boost your cash flow quickly. This approach will also enable you to manage coronavirus restrictions effectively and reduce the pressure to work harder and longer. And once you implement what I'm going to teach you, you'll have more production, collections, revenue, and profits in your business going forward. Let's dive in. But first, a quick question for you. How much do you think about profitability when you're scheduling patients? Let me know in the comments. So how do you increase production when you can't see as many patients? First of all, organize your schedule so you book the critical patients first. For instance, in the past, you might have scheduled 12 or more patients per day for hygiene. Do you really want to see that many patients in a day now? No, because fewer patients lowers the risk of coronavirus transmission, plus you save on PPE and the amount of time you have to spend on cleaning. But if you're seeing fewer patients, you have to make sure they're having higher value procedures. Fortunately for us, the patients who give us the highest production are also the patients who need to see us most. So how do you organize your schedule so these people are the ones whom you give your priority? Do you know how to fit rocks, sand, and water into a jar? If you don't have a plan and try to cram everything in without any thought, you're not going to have a lot of luck. But if you start with the rocks and then add the sand, followed finally by the water, it all fits. This is exactly how you should approach your schedule. Longer procedures such as unscheduled bridges or root canals are your rocks, so they go into the schedule first. Then the shorter procedures are either sand or water. Add them accordingly. So how does this work in practice? You have to be very strategic. First of all, it's much easier if you start with a clean slate. So create a new op on Dentrix or whatever system you use, and move your patients into it. Now you can design your new schedule efficiently. If you need an hour and a half for 4 quadrants of root planing, for example, block them off in your schedule and aim to fill these spaces first. These quadrants are for your priority patients who need more work. We'll talk about how to select patients in a moment. Offer your patients the 4-block quad first, but if they don't have the budget or the time right now, have some 2 quad blocks available too. Color code your blocks so you know which are the most important to fill. The stoplight colors red, yellow, and green work really well. The 4 quad blocks that are your priority are red, the 2 quad blocks are yellow, and the rest are green. It's a good idea to schedule blocks for Mondays, Tuesdays, and Wednesdays, but leave Thursdays and Fridays for patients who prefer to come at specific times. Now you have your time block set up, you can contact your patients. Again, you need to be strategic about who you contact first. Use your practice management software or a third-party tool to create a filtered list of patients who are your top priority. This might be people over the age of 60 who have been seen in the last year and have unscheduled perioscaling and root planing. These are the patients you need to see first because they're already a couple of months behind getting care and their oral health is the most vulnerable. Invite these patients to have all the work they need in one go, rather than over multiple appointments, and block them into one of your red 4 quad blocks. And again, if they don't have the budget or time to do all their treatment together, offer them a 2 quad block instead. Make sure you do the big cases first, and then fill in the single fillings and single crowns after that. rocks, sand, water. Remember? This system means you can prioritize the patients who need you most, reduce the number of people coming into your practice, lower the chance of coronavirus transmission, reduce the amount of PPE you use in cleaning time between patients, and increase your cash flow. How do you present this option to patients? Well, first of all, remember, many people have been stuck at home and want to get out and do something for themselves. For example, the first time I had the opportunity to go out, I went to get my nails done, but then I realized I could have a facial, waxing, and have my hair done too. I did everything because I just wanted to do something for myself. You can say to your patient, Mrs. Jones, we're open and we're seeing patients, but we have a lot of people to schedule. You're a high priority for us because you have periodontal disease. If you can, we recommend you get all of your treatment in one visit. We're scheduling so many people right now. If we break up your treatments, you might have to wait a really long time between your visits. That wouldn't be very smart because you have an active infection. If we do it all in one visit, you can get back to being healthy as fast as possible. You can also tell your patients that you're organizing your schedule in this way so you have fewer people in the practice, which minimizes the chance of coronavirus transmission. To further increase your efficiency, you can do these 3 things. First of all, allow your hygienist to focus on the tasks only they can do. Let the assistants take x-rays and internal photos and show educational videos. They can also have discussions with patients to find out their chief concerns and then transfer the information over to the hygienist. Secondly, introduce an overflow room where the assistant can get the patient started while someone else cleans the other room ready for the next patient. And thirdly, stagger appointments so they don't start and end at the same time to prevent a bottleneck at the front desk. Now that you've got appointment scheduling covered, I have a free resource to help you improve your case acceptance rate, especially with those high-value procedures. In the comments below this video, you'll find a link to download it, so be sure to grab that now. Also, if you want to join a community of dental bosses just like you, I invite you to join me in Dental Boss Academy, where hundreds of dental bosses are learning, connecting, and collaborating. Join us in Dental Boss Academy if you want support and training as you grow your dental practice. The link is below this video. If you like this video, please let me know by liking it below. Be sure to subscribe and share it with other dentists who could learn from it too. And don't forget to comment below with Dental Boss if this video helped you increase your cash flow while seeing fewer patients.